Well, good afternoon. Welcome to the program. I'm Andy Johnson for today, Thursday, October 10th, 2019. Lots of stuff in the news these days. The government is holding still a forum which began this morning at the Radisson Hotel in downtown Port of Spain, in fact, on the waterfront, what they call focus on the budget. So this is the third day or the fourth day since the budget has been presented, where there's been continuous discussion over what's in it, and the government has decided that it needed to do some more explanation about what's in there. And given the reactions from the people, even the Prime Minister saying that there are people who still don't understand the government's position over these 4 years, what it has been required to do, given the state of things in the country. That's one. And then, well, the country also is reacting to the news yesterday of the find of the 69 people in this facility called the Transformed Lives Ministry. You know what the conditions as reported have been, and that is a continuing story as well for us in the country. The murder count today is 408. You know, those things just to keep you in touch with what's happening, where we are with crime and criminality in the society. But the discussion this afternoon has to do with dealing with one of the many disabilities with which people in Trinidad and Tobago have to confront. This is with sight and the issues having to do with sight and sightlessness. I don't want to say blindness. So today is what is called World Sight Day, and on days like these, we pay attention to people with that disability, if we could in fact still call it that. Is it a disability or not? We have on the line with us one of the longest campaigners that we know in Trinidad and Tobago on the questions of treating with people who have problems with sight, people who are blind, people who are visually impaired. Mr. Bhawani Prasad. We'll get to him in a moment, but in studio with us is Sofiyya Hassanali, representing the Optometrists Association of Trinidad and Tobago. Good afternoon. Good to have you.
Good afternoon. Thank you for having me.
All right, let's start to talk about the connection between your association and people with so you say blind people or people with visual impairment, because you have various grades of visual impairment, right?
Well, PAVI itself, which Mr. Bhawani represents, is persons associated with visual impairment. So there are many different levels of visual impairment. From your perfect 20/20 vision, that's always ideal, and then going downwards from there. There's a lot of, as you say, gray area before you actually reach blindness.
Yeah, blindness is when you totally, absolutely can't see.
Right, so actually before you reach blindness, you also have light perception and no light perception. And when you reach no light perception, that's when you would say you are officially fully, unable to see, blind per se.
I've had many discussions on this issue over the years that I've been in this business, but every time you talk with somebody like this, you get different insights. And so let's talk about, you said when you have no light perception.
Yes.
You need to be able to see light.
Precisely. So sometimes people who can't really see much of anything else, they can still perceive light. They can see, they can track it, they can at least see that there is some light in one direction versus another. An open door with a light in the room versus a dark hallway, that sort of thing. But one thing I'd like to mention as you are going down this road is a lot of people have that misunderstanding. I mean, there's a lot of, as you say, gray area. But a lot of times just because you see someone with a cane does not necessarily mean that they are fully blind. A lot of times if you see people looking at their cell phones and they have a cane and you think, how on earth are they doing this? It is because they are visually impaired to some degree, but not fully 100% blind.
Yeah. Well, there's this story that I live in Arima for the last 32 years, and there's this man who walks around a certain part of the Arima Savannah, so if you know Arima at all, around the market. It's called Pro Queen Street. So he traverses that without let or hindrance, as people would say. He has a cane.
Yes.
And you come to the market. He knows where he's going, like he knows which lanes that he needs to go into the market, and on the side of the market, he knows how many steps it takes from when he exits the market to where he has to go. And there are people who doubt he's blind, but he is.
They're very comfortable. They know their comfort zones, and as you say, they're aware of their surroundings. And as family members or friends of these people, it's very important that you don't make these changes. So it's important that the doubles vendor stays where the doubles vendor is always supposed to be. You sell your carrots where you're supposed to sell your carrots. You sell your cucumbers where they usually are. When you throw off that, that's when things get a little bit hazy. Same things for the kitchen. I've eaten food cooked for me by someone who's blind per se, and everything tasted fine because they are comfortable in their kitchens. and in their surroundings.
Yeah.
Very capable.
Yeah, I mean, there's a famous story that I heard one time. Quincy Jones, a famous musician and composer and arranger and so on, he was talking about hanging out with Ray Charles. One time he went to his home and he said, well, it was afternoon, so they were talking. They spent a lot of time talking while Ray Charles was cooking.
Yeah.
And, the dinner was finished when it started to get dark. And when they sat down to eat, he asked Ray Charles, "You're not putting on the lights?" And Ray Charles, "What lights?" Because he totally forgot
That the lights were off.
Or that this man was blind, but he was amazed by his ability to cook and be in front of the stove and all that.
Of course.
And so a lot of blind people, have those kinds of
They
capacities.
manage. They make do.
They're not
They
helpless.
have exactly. They've found ways to get around what you might call their disability, but they've managed just fine. Now, of course, it's different for some people who are born a certain way versus people who end up blind later on in life. It's two very different circumstances at the point in life that you do end up losing your vision. But most people, you'd be surprised. There was a study out a few years ago that vision is actually the number one sight people fear losing the most. You could survive if you lose the ability to taste or to hear, but to see, it's difficult to comprehend.
Or the smell.
Smell, that might be a benefit sometimes, actually.
If you don't.
I mean, the way Port of Spain is looking right now with all the flood and the water, that might be a benefit if you can't smell it.
All right, so let's zero in on some things. What's the connection between your association or your profession and blind people or people with visual impairment?
Well, so first and foremost, optometrists, we don't necessarily help those who've already been diagnosed as fully blind. We help everyone that is up until that point. So we help people prevent reaching that point. We hope that people don't reach that point. So World Sight Days this year actually focuses on vision first and the importance of making sure that everyone has a regular eye examination, that everyone has access and can afford an eye examination. Because a lot of times people think that an eye exam is just for glasses, and needing glasses is important. Uncorrected refractive errors, which is what we call the need for prescriptions for glasses and sight. This is actually one of the greatest causes of vision impairment and vision loss per se.
Uncorrected refractive
Errors. Yes.
Yeah.
So when you get your eyes tested, you're actually having a refraction performed on you, and that's the measurement of a spectacle prescription.
Yeah. And so sometimes people just neglect those things, don't pay attention to it.
They do, or they think that they're seeing fine enough and they don't need glasses. But going to get your eyes tested is also very crucial for checking the health of your eyes. There are a lot of diseases that can creep up on you and cause permanent damage to the eyes. And if they're not tested or detected early, that could be very detrimental to your sight. So it's very important that you do get your eyes tested every year for the health of your eyes and any eye diseases that could be affecting your vision, not just glasses.
Yeah, so that's one of the things that people must put on their annual calendars.
Yes, definitely.
Because a lot of people big on medical checkups.
Precisely.
I'm saying a lot, but sometimes even there, a lot of people don't observe those things.
Well, what a lot of people don't realize as well is that getting the eyes tested is actually very important for your general health. The eyes are actually the only part of the body where you can see blood vessels and nerves without having to cut. So getting a test at your optometrist, where they are going to look at the back of the eye and the health of the eye, could actually even help to detect certain things like diabetes, hypertension, signs of stroke, even certain brain tumors. These are all play very critical roles on the eyes. And if you don't know it, we can help detect it.
Yeah.
So it is systemically connected.
So looking at me now, you could see.
Well, I don't quite have the equipment, but we could set up an appointment for after this.
All right. Thank you very much. So let's talk about the connection with World Sight Day, because there's some activities that are scheduled around it, right?
Yes. So on Sunday, we have the annual World Sight Day walk, which is taking place around the Savannah at 7 a.m. This is being hosted by the Committee for World Sight Day as well as PAVI, which Mr. Bawani represents. It'll be commencing at the grandstand, and this will be followed by the blind people can cook too, which is actually what we were talking about.
Yeah.
Which is going to be happening right after, hosted by the advocates for the blind and vision impaired. So everyone is welcome. Registration is $100. You'll get your shirt so you could blend in with the crowd. And we'll all be walking to raise awareness and raise some funds for those that are visually impaired in Trinidad.
Okay, that's Sunday.
That's Sunday at 7 a.m. around the Savannah.
Yeah, all right. And it gives me an opportunity to mention another activity having to do with people with disabilities. This is an organization representing people in the business of palliative care, and there's the other word for it, but they are having their march around the Savannah on Saturday from the 7 o'clock. I'll get back to that in a moment. But this is a good point at which to bring you in, my friend, Bhavani Prasad. You've been listening. Good afternoon.
Yes, you all have been doing a pretty good job.
Yes.
Just to say that low vision people, we always advise them, because of the level of their sight, to always have their cane on hand, especially during those twilight hours, Andy, because when the twilight hour comes up, they are sometimes like in no man's land, because the vision is blurred. So we always advise them, if you're on the roads at that time, please make sure and walk with your canes. I have known of situations where people have gone to bus lines and they're legally blind. They're not totally blind, but they're blind. But what happens is that people feel that they're playing blind, and there was a pass out one time in Chabonas over that.
Yes.
You know, so all of these things, as we say, prevention is better than cure. And the most important thing is that, one, you get your eyes tested. But if you lose your sight, there is still hope. I always say there is life after blindness. So any kind of disability, it calls for adjustment, it calls for a whole adaptation of you, your family, etc., your community towards you as an individual. But there is life after blindness. Now, just to say that for the last 2 years, the World Sight Day Committee in association with PAVI, Blind Welfare, and PAVI have been holding this annual World Sight Day walk. Previous to that, this was carried through by the World Sight Day Committee, which we all supported and continue to support. In addition to the walk and the cookout, His Excellency, the President of the Republic, will be in attendance. She'll be walking the walk with us, and that is something good. And in fact, this year, again, because of the joint initiative of the agencies, we've had a lot of good work done with the President's House and the President in terms of bringing greater awareness, not only to herself, but to her staff, etc. We had a screening program for all members of staff in January. We had a dinner in the dark in June, and everybody ate, in the dark, so to speak. There were some little glimmers of light, but for the greater part, it was dark, and people spill things all over themselves sometimes. And just it goes to show that, whether you're blind or not, you have to perform, and you must perform. Sometimes you might make a little accident, but that is all part of life.
Yeah. So it's the World Sight Day Committee, and that committee comprises representatives from the various sort of support groups and associations.
Yeah, the World Sight Day Committee of itself are members of the Ophthalmological Society.
Yes.
And they have teamed up with the other agencies, as mentioned, so that we are collaborating on some of these projects now.
Yes. Just again, it's, a lot of times, professions are broken down into sort of subdivisions, and a lot of people, struggle with understanding. You say the Ophthalmological Society, right? Mm-hmm. So there's ophthalmology, which is one kind of eye doctoring, and then there's optometry, right?
Yeah, well, that debate we'll have to carry on with Sofiyya, not I think the ophthalmologists, if I'm not, misquoted, they are the actual doctors. Now, yeah. Optometrists do have a level of training,
yeah,
and they can do certain things, but they also refer patients, if the situation is that warranted, to the ophthalmologist, who is indeed the eye professional doctor. Correct, Sofiyya?
Yes, that is correct. We are the primary eye care providers.
Yeah.
So we would be the ones that you come to when you have initial problems and for your annual exams. And if any further attention or treatment is required, then you would go to them for the treatments such as surgeries, etc.
That's the optometrists.
Optometrists are the primary healthcare, and the ophthalmologists, they'll be the specialist doctors that would be taking care of the treatments such as surgeries.
Yeah. So the surgeon is the ophthalmologist.
Yes,
yeah.
yes.
Right. And the man who makes the glasses and so on, the optician.
The opticians, yes. So you actually have 3 levels of eye care providers. Opticians being the ones that help with the measurements of spectacles and making sure that they fit properly, because there's an entire science behind making sure that glasses fit on your face properly and that the prescription is exactly where it should be focused as well.
Yeah.
And remember that we are operating gender balance, so you don't have to sit a man, person.
Okay. All right. Yes. Thank you very much. Thank you very much for that. But I wanted to get to, the reasons sometimes for the different kinds of awareness groups that come up around an issue. So that we're talking about PAVI, we're talking about the Blind Welfare Association, we're talking about, you called another name, Ms.
PAVI, that is the association. Well, the PAVI group is a group within the it's a group of blind people who mainly comprise of employees of the Blind Welfare Association.
Yeah.
The Blind Welfare Association, which is the main service provider. PAVI is both a service provider and a group all made up in the main of blind and visually impaired persons. So we try to feed both sides of the spectrum.
Yeah. And it's not a case sometimes of because people have different areas of focus, or sometimes people have different approaches. You find that, the thing gets somewhat split. Yeah.
Yeah, but it's also important to know that one agency alone cannot do all the work.
Yeah.
We have to team up. We have to collaborate. We have to put people out there in the field and get the job done as best as humanly possible.
Can I ask you at all to talk a little bit about what are some of the services that are required for dealing with and reaching out to people in this cohort of the spectrum of disabilities in the country that require to be addressed, and say, for instance, what your group may have expected to hear in this budget or in budgets past that still remain unaddressed.
Well, now you're asking me to put on my consortium hat.
Okay.
Right. Basically, we didn't. A lot of people anticipated that this would be a sweetheart, a condensed milk, call it what you will budget, and things will be given freely. Over the last 4 years, we have seen some increases in grants, disability grants, etc., public assistance for children with disabilities, etc., and we have seen, only yesterday I was at the Ministry of Education, Student Support Services, and it was acknowledged that schools which operate for students with disabilities have received a greater impact in terms of receiving their disbursement of funds from the Ministry of Education to carry out the work, because the government cannot do it alone. Agencies have to chip in and do what we have to do in terms of education, etc. So no one group can do it alone, but there are things that we can collaborate on. There are things that we do different. If you take your mind back to the 90s, Andy,
yes,
when this bill was passed to allow blind persons to vote independently,
yeah,
that was an initiative of PAVI.
Right.
Now we're collaborating on, the Blind Welfare recently had an initiative where the traffic light at the Hyatt and some other traffic lights now have talking devices, etc. So each agency will find an area to work with and to support as we empower blind and visually impaired persons.
Yeah. Let me ask you about some months ago, if not more than a year ago, the Minister of Health had announced with great fanfare this initiative about sort of speeding up and increasing the number of surgeries that were to be conducted in the state medical facilities for people with disabilities of one kind or another. And he talked about cataract surgeries that they called Surgery Sunday. And that was to have been something that was ongoing. I'm not aware to what extent it has been ongoing.
I don't think the impact has been as great as the ministry would like. We still have people on waiting lists, etc.
Yeah.
I know we had a vote recently in La Brea, and they did some surgeries on persons with disabilities, etc. But in terms of the waiting list, generally at the public hospitals, they are still very low.
All right, so stay with us. Let me just bring back Ms. Asanali. On that issue, sometimes that is what, for some people, leads to well, worsening situations and total blindness, the length of time it takes, the delays between they get the diagnosis about cataracts and they
Yes.
don't get it treated.
So actually, just as of yesterday, the World Health Organization issued their 2019 vision report. And they said that internationally, 39% of people that are considered visually impaired is because of unoperated cataracts. Now, cataract
39%.
39% across the world, yes.
Yeah,
And cataract surgery is actually one of the easiest and one of the quickest surgeries you can have, with one of the most positive and long-term, long-lasting results. Most people after cataract surgery can get down to 2020, or between 2020 and 2040 vision, is which we consider very good once a success of the surgery. Now, locally, there are long wait lists in the public hospitals. If you want to go privately, of course, you can always spend your money and you can get it done much quicker. The waiting list in the hospitals it differs from one to the other. So between Mount Hope versus Port of Spain versus Grandy, your results and your times are going to be different.
Well, why is that? As far as you know.
There's a lot behind it. I mean, it could be the number of surgeons, it could be the number of patients in that constituency, as well as the other types of surgeries that would be necessary as well. There are many different types of eye surgeries.
Population size in the various constituencies or demographics of the country, because San Fernando, they also have a long waiting list.
Yes. But there seems to be some extent to which, let's take Sangre Grande. The Sangre Grande Hospital is emerging as the preferred go-to place for certain kinds of surgery and treatment. Is that because it's easier there, or somehow because the doctors there have doctors who go there have a better reputation in terms of the performance than others, as far as you know?
I think it's a combination of issues, including population size. Remember that going to rural, Toco, Matlock, etc. People will avail themselves from other parts of the country because the staff and everybody, it's very welcoming. At Grandy Hospital, I understand. So I think all of these factors will weigh in on why people prefer to go to Grandy than some other established institutions.
Yeah. All right. So, Bhavani, let's we want to take a break, but let me just ask you. So, for Saturday, and we want to go back to that when we come back. So you what's your dish? You were cooking?
No, Sunday?
Yes.
No, I am doing what I do best. So.
Yes.
No, but that's a Sunday. But the TTOA is also having a dinner on Saturday night too.
Yeah. All right. So
we'll share some information on that one.
All right. Stay with us. We coming back on this. That's Bhavani Prasad, a long time campaigner on the issue of sight awareness in Trinidad and Tobago, visual impairment. And in studio with us is Sofiyya Hassanali from the Optometrists Association. We're talking about World Sight Day, which is today, and some activities taking place on Sunday, a walk around the savannah, and an event blind people can cook. Stay with us. We're coming back. Welcome back. We're talking in the context of today being observed across the world as World Sight Day. We're talking with Bhavani Prasad of the organization people associated with visual impairment, the Blind Welfare Society, and in studio, he's on the phone and in studio with us, Ms. Sofiyya Hassanali, an optometrist from the Optometrists Association in Trinidad and Tobago. And they say that World Sight Day is an international day of awareness held annually on the second Thursday of October to focus attention on the global issue of eye health. So that is today. That's why it's being recognized today. The major aim from this awareness platform is that everyone should have a regular eye exam. Ms. Hassanali suggests that should be at least once a year. And let me tell you something about what this information sheet is saying. Not just glasses, although a check for eye function and eye diseases. Eyes really are the windows to the soul. And the only place you can see blood, she spoke about that earlier, vessels and nerves without cutting is through the eye. Let's just tell you this, that 36 million people across the world are considered blind, and 80% of all blindness or moderate or severe distance vision impairment is considered avoidable. Let me ask you, do we know what the figures might be in Trinidad and Tobago? How many blind people there are?
So we actually had the Barbados Eye Study that was conducted a few years ago. so particularly to Trinidad, we have a higher prevalence of glaucoma than what is the international average. Glaucoma is a disease that affects people more of the African descent, and more so people over the age of 60 or people that have a family history. That is one thing that sets us apart from a lot of other countries. They call glaucoma the thief in the night because it actually has almost no symptoms. You lose your peripheral vision, which you don't usually notice initially. And when you do notice it, it's usually too late. So we get most of our statistics from the Barbados Eye Study, which was conducted quite a few years ago, over 10 years ago. We had the National Eye Study of Trinidad and Tobago. The results are still coming out, but we do know, again, as we go back to what we were discussing before, the cataract operations is definitely something that is also affecting that list in statistics. Now, the 2020 initiative of the World Health Organization that was established a while back, that has drastically decreased the number of people with uncorrected refractive errors, which is what we discussed again earlier. But those are people whose vision can be helped with glasses, people that just have difficulty with focusing because they need that little extra help of glasses. That with the opening of more optometry practices, the opening of the UWI optometry school, and together with putting optometrists in the public health centers and the hospitals, are great steps towards making sure that everyone gets equal and affordable access to eye care, not just for glasses, but also to ensure that they don't go down the road of eye disease.
Are you in a position to pronounce upon what might be equal and affordable?
Well, it all depends. I mean, there are many factors, and what is equal and affordable to one is different from the other. But the cost for cataract surgery for one is roughly, give or take, about $10,000 across the board if you go privately. Now, that is just one eye, and again, that has many factors. It could be your general health. If you want platinum grade new lenses in your eyes, and of course you're going to have to pay for the extra bells and whistles. So you have to decide for you what's more important, time or money. You can go to the hospital, public health centers, public hospitals, and get that done, without having to incur that cost. But the inconveniences that it might cost you, not being able to really work, not being able to provide for your families, is that worth that time to you? Time is money.
Well, let me tell you a little story out of school as you raise that thing about affordability and what the processes are. My sister, younger than me, had to have some eye surgery about a year ago. And she was given a fee for the surgery, right? Instead of do one eye and then do the other eye, right? But there was a total fee for that. And then there was another fee to remove what had been put into the eye after the surgery, and we thought that weird. You got a sense that, well, this is the cost of
right,
this,
of course,
of this treatment of the surgery, and not that part was to put it in, and she had to find money to take out whatever they put in.
I mean, it really depends on what the surgery is, and it also depends on the individual. For example, someone who is young and healthy, their curing process, their rehabilitation process post-surgery is going to be different from someone who is diabetic with kidney disease and hypertensive. So there are many factors in somebody's healing process which could cause higher risk for infection or higher risk for needing to go back in. Now, in the case of having to take something out, again, it would depend exactly. I would need a little bit more details than that. But sometimes
put in a lens or something like that, and then.
So sometimes when they go in, if there are complications during the surgery, again, this would be with the ophthalmologist, not the optometrist.
Right.
If there are complications, they might have to go back in to fix something. Again, persons with medical issues, more systemic medical issues that don't heal as well, do provide other complications. So maybe things would have to be adjusted. Also, cataracts, once they put the new lens in, sometimes it has to be polished off. Again, depending on the patient specifically. Now, cataract is something that comes with age. It is a natural part of the aging process. Everyone is bound to get cataract at some point in their lives for the most part. It's just like gray hair. None of us want it, but some of us get it a little bit earlier than others. You don't look like you have that problem too
Yeah, I
much.
do.
You all should see the shine over here. Yes, so I mean, it's something that everyone's bound to get. Now, of course, as with everyone, those that age a little bit faster than others, with some of the associated risks like sun exposure, poor health, diets, etc., there would be more risks, and they might have to get the surgery a little bit earlier than others. I've had patients come into my office and they're in their 80s and they're now starting to form cataracts. And I've had patients who are in their 40s and I'm telling them they need surgery right away. So it really, really depends on the person themselves, their general health, the surgeon, the success of the surgery. Sometimes it could be a bit rigorous and difficult for the surgeons. It's really all depending on those factors.
Yeah. All right. Let's come back to you, Bhavani, about your experience. As an advocate for people with visual impairment, for the blind in Trinidad and Tobago. Is it rewarding? Is it energizing? Is it inspiring, or all the opposites to that?
No, it is rewarding to know that you could help somebody. It is inspiring to know that somebody out there needs your advice. That kind of thing. So it's not totally all lost. I would have to say that being over 60 now, when I was about 19, 20, now starting to roam the streets, the attitude of society was much different. Because today now people are learning, people are reading up, people are observing, people are traveling more, so they see what's happening in other countries. It's just that some of the right things we need implemented gets back a little more than the wrong things.
Yeah.
In general terms.
Let me ask you this. Are we still in the stage where, well, at least, people coming up will be sometimes, have to get into the culture and the customs and learn the road has been traveled before, so that a youngster coming up now in interacting with a blind person may feel you have to shout because they're blind, you think they're deaf.
Yeah, well, that assumption still hangs around. And we're trying to correct that myth because you may be blind alone. Now, true enough, in today's world, we have persons who are multiple disabled, and that poses its own challenges.
Yeah.
If you're blind and blind alone, or if you're deaf, hard of hearing alone, well, then there's a different spectrum. But we find all kinds of scenarios at play, and it depends on how you as the individual take things in stride, because you may have to correct somebody. Thank God that people, hardly use the word cookie eye and that kind of thing these days, because there is the people first language and all of that, which people are getting into slowly but surely. And Sofiyya made a point about cataract surgery. Now, I'm sure you will remember, Andy, in the olden days when you hear somebody say they have sugar, say that person is an elderly person, of grandmother status or grandfather status. Now we see that diabetes, it starts in children. And that is because of the lifestyle that some of us live and the diseases associated with some of the habits and some of the things we do to ourselves sometimes.
So that the lifestyles of the parents can pass on some of these things to their children, because juvenile diabetes has nothing to do, well, very little probably to do with the child, him or herself, right? So it's inherited.
Again, you may get what we call hereditary situations, but you also get a situation where because you don't check on your child's health, you allow them to eat and drink whatever they want, and they get obese and all of these things. These things can lead to diabetes at some stage.
Yeah.
So you have to monitor as parents, as guardians, ensure that your child does the right thing at the right time.
Oh, let me just read from...
17 and 15-year-old, the way they look, I don't see them, thank God, that's the way they look, they obese already.
Yeah. All right, let's just, in the time we have, a couple of minutes, I thought it was more than that, but that's blessed. Let's see what people might be thinking about what we've been talking about and what their responses might be, their perspectives on this issue. One of the numbers to call is 6128255, 2228255. We're talking in the context of World Sight Day, which is today, observed across the world, and we're talking about having to do with that is being observed on Sunday as well, with a walk around the Queen's Park Savannah in Port of Spain. Among those people who will be participating in that, as Bhavani Prasad, who's on the line with us, said, would be Her Excellency the President, Paula May Weeks. So what are your thoughts on it? And while we wait for a call or two, let me
This forum actually takes place at the start of the week, of a week of activities.
Yes.
But this year, because of the IBC walk, which was held last Sunday,
Yes.
we decided to change the date because we would not have gotten the kind of impact we normally get.
Yes.
Normally, over the last couple of years, they have had also a seminar, a symposium on eye care and blindness prevention. This year, they preempted that. So the focus will be definitely on the walk on Sunday. And sometimes, like the Glaucoma Association, they have Glaucoma Awareness Week in the month of March. They have different weeks. Diabetes is in November, World Diabetes Day. So
right.
There are different things that relate to blindness that are held other than today or
inside day.
Or any other day.
So the other things that contribute to failing eyesight and then blindness, when those days come around, that is addressed in there as well. That's the point you're making.
Yes.
Yeah. Let me just read from the World Health Organization information sheet here on this. It says that 18% of the issues we have with impairment and blindness are the result of uncorrected refractive errors. That's what Ms. Hassan Ali referred to earlier on. Unoperated cataracts is 39%. Macular degeneration, 12%. Just tell us what that is, macular degeneration.
So I'm actually going to discuss macular degeneration and diabetic retinopathy together.
Yeah. Right.
So the retina is the tissue in the back of the eye, and that is where all of the blood vessels feed into the eyes. So the macula is actually very center, the bullseye per se, of where you focus.
Yeah.
So when the macula degenerates with age or with waste deposits that build up in the eye, that causes central vision loss.
Waste deposits building up in the eye.
Right. So toxins, toxins that are released in the eyes.
Okay.
They build up and they can impair your vision. In the case of diabetes, with uncontrolled blood sugar, you can end up with bleeding and swelling when the vessels in the back of the eyes are affected by elevated blood sugar levels.
Yeah.
Both of these diseases cause damage to the macula, again with the buildup of the deposits or with the bleeding and swelling. Both of these affect your central vision. So this could be very sudden vision loss or it could be gradual. And both of these are very serious. Like I mentioned with glaucoma affects your peripheral vision and then it hones in like a tunnel. But these two affect your central vision. And diabetes is very, very high in Trinidad, and therefore diabetic retinopathy is also very prevalent. So the numbers that you have internationally versus our numbers here would differ in terms of the ratios.
Right. So because this is WHO figures globally,
and those again were released just yesterday.
Yeah. Right. But it says here that diabetic retinopathy accounts for 4% of impairment and blindness.
Yes.
You say that is global in Trinidad and Tobago. It's
in
likely
Trinidad,
higher
it's
much higher than that.
very high because unfortunately our consistency with taking our medication is not as it should be. People don't realize all of the dangers they put themselves in when they don't take care of their blood sugars. Again, if you can have bleeding and swelling in such a small part of the eye, can you imagine what's happening throughout the rest of the body? And also, when your sugar is elevated, that also causes blurred vision. It causes your prescription to differ.
Yeah.
So I'm sure there are many people who have been to optometrist's office for their eyes to be tested, and they've been turned away per se because they've been told that their blood sugar needs to be regulated. The reason for that is because their vision is fluctuating. And when your vision is fluctuating, you're not sure to get a proper prescription. And no one wants you to spend money and the glasses aren't going to work afterwards. So these are all very, very, very important reasons why you need to keep your sugar under control. We've been talking about diabetes for people of all ages, and it's important that you know for everyone the risks you put yourself through, not just with your eyes, but in general, when you do not control your blood sugar.
All right, thank you very much. We could go on for much longer because of the high interest about these matters. But Bhavani Prasad, we have to end it. So are there any final points you want to make?
Yes, as we always say, an ounce of prevention is always better than a pound of cure. But remember that if you lose sight or have lost sight, or any family member, the support of the family is very important, and we have the agencies that are geared and ready provide the adjustment to blindness, because I always say there is life after blindness.
Okay, right. And so the walk is Sunday morning, 7 a.m.
Right and early.
Starting where?
From the grandstand area, just in front of the grandstand.
Grandstand, Queen's Park,
and going right around the savannah.
And the event, blind people can
the
cook?
Cookout, the blind people can cook too. That will follow the walk and all the speechifying and things, as we see, the formal ceremony.
Yeah.
The cooks will start their task from 8 o'clock, should be completed just after 11, and those who stay on will have an opportunity to sample the food that is prepared by the various cooking teams.
Yes.
So
all right, thank you very much, sir.
Sunday.
Thank you very much. So, Sofiyya Hasnani, you have the last word if you want it.
The main thing I want everyone to know is that they all need an eye exam. Please I encourage you, your loved ones, your friends, your family members, all of your colleagues, get your eyes tested. You never know what you could find, and it'd be a great benefit to you and all of your loved ones. It's not just about glasses. Get your eyes checked for the health of the eyes. Thank you so much for having me today.
Thank you very much. It's been a pleasure. This will do it for us for today. That's State of the Nation today, Thursday, October 10th. I'm Manny Johnson. Thanks for listening.